As we do each week, we will move to the Berks County COVID-19 data report, and we have Brian Gottschall, the director of our Berks County Department of Emergency Services and the lead on the Berks County COVID-19 leadership team. Brian.
Good morning, Commissioners. Generally a great report for this week as far as the community conditions, and also, I believe, very brief. Starting out with our information about cases over a smooth 14-day period, we continue to see the very nice decline that we have been seeing now for the last week and a half to 2 weeks. Again, this is a 14-day smooth case curve. If you look at the 7-day curve, it looks even better, and we've dropped lower because we're still rolling off some of those higher results from back in the beginning of the 14-day period. Throughout the nation, case rates continue to be very high, and this is kind of our changing perspective on the COVID emergency. We would have been very happy to be where we're at right now just some time ago, but if we would have looked at this 2 years ago, we would have still said our case count was very high. So, it's kind of adjusting the perspective from where we're standing, and that changes our outlook on the whole condition. But across the nation, we still see a very high percentage of counties with the what is considered high case rate or high case community transmission. Couple slides we look at this week. I'm going to make a recommendation that we back them out of the presentation moving forward. This is the first one. We began looking at pediatric case counts back in the fall when we had a lot of concern about potential disparate impacts on the young kids, both because of changes in the virus and also because of the lack of vaccine available for those age groups. As we've seen, the pediatric cases have very much trended with the community cases, so I'm going to recommend we back this slide out. We'll continue to look at it internally, and certainly if there's any new data or anything that comes up that we believe is noteworthy, we'll bring it back to the community's attention. But lacking that, this will be the last week we look at this slide. Our hospital slides, again, more great news coming out of Reading Hospital. We still don't have good data out of St. Joe's because of their reporting issues that they're experiencing. So we still have those cells struck through. But at Reading, our total numbers in the hospital are about 50% of what they were just a week ago. And if you go back and look at this about 3 weeks ago, we're at about under 25% of where the hospital census was. Remaining pretty flat as far as those that are unfortunately in the ICU or needing a ventilator. But again, we're seeing downward or flat numbers, not upward numbers, and that's what we're hoping for. Our influenza slide is another one that I think we can back out after this week. Again, we'll continue to track. We did see a leveling off this week in the red line. As you can see, we flattened out. We didn't continue to go down. But if you look at these trend lines over the last 8 or 9 years, and I'm no epidemiologist, but you can certainly look at the lines and see that in the last 8 or 9 years, we've not had a situation where when we've seen such a downward trend, it has resulted then in a following upward spike. So it very much looks like we're on the tail end of influenza for this season. Again, we'll monitor it, and if anything changes, we'll bring it back to everybody's attention. As far as current events or things on the horizon, the number one thing we want to focus on is the Berks Cares Vaccine Center out in the Walmart Shopping Plaza in Muhlenberg Township. Based on the community need for that service and what we've seen as far as what people want, a joint decision was made between St. Joe's, who is operating that center in conjunction with the county, to change the hours to Thursday evenings from 4 to 8 p.m. and all day Saturday from 9 a.m. to 4 p.m. Again, we would encourage folks to go to the Berks Cares website to find the links to go ahead and register for a vaccine if they desire. But we believe that this number of hours is going to operate the center more efficiently and more directly address the desires of the community that we've seen at the vaccine center. And then the other things that we want to keep on the radar are the under 5 vaccine and the Omicron BA2 subvariant. But in both of those matters, there's really been very little new information that's come out in the last week. So we don't have a whole lot to say about that. Hopefully in the upcoming week, that will change. And by Thursday of next week, we'll be able to give you some more information. Just reiterating the public COVID drive-up vaccine testing site operating here at DES in conjunction with Department of Health, and their contractor continues to operate. Currently is scheduled through this Saturday, 2/12. The times are on the screen and available at the doyourpart.com, doyourpartberks.com website. We are talking with DOH about the possibility of a further extension on that, but at the moment, what we can commit to is that that site will be open through Saturday. And if we are able to extend it further, we'll of course publicize that in all the normal ways. I think this picture is getting old, but asking you how to come into the site off of Van Reed Road, not off the MacArthur Road side of the facility. And with that, commissioners, we remind everybody about the website and turn it back to you.
Thank you very much, Brian. Appreciate the report. Any comments from my colleagues?
Yep.
Okay.